Hello, and welcome back to Educate Me MD. Today we will continue on the journey of a newborn who is only a few hours old, focusing on the newborn exam and the erythromycin eye ointment. I will go into uncommon depth on common topics to explain the ordinary in a new way, so please join us. I am Dr. Sarah Soltz. I'm very excited to be back today for our second episode. I don't want to waste any time. We'll jump right back into the story we were telling last week. To recap, we are following a healthy newborn baby girl who was born at term without any complications and has had skin-to-skin time with mom, nursed well, and been weighed and measured. She's beautiful and active, and so next a doctor or nurse will often take a few minutes to do their evaluation. Initially, this baby may have multiple exams by different staff looking for different things. Depending on the size of the facility where the baby was born, maybe only 1 or 2 people, or as many as 5 to 6 if it's a teaching facility and there are students and residents. Nurses and techs often need to check vitals and give treatments, while doctors and other advanced providers need to do a more thorough exam to look for any birth defects or unexpected findings. A lot can happen when a baby is transitioning from being in the womb to being born. So there's always new things that can pop up that we weren't expecting before the baby was born. When I am one doing the evaluation, I typically do a full head-to-toe exam. And so I start by feeling the soft spot on the top of the head to make sure it's not too big or small, that it's not bulging or sunken. And then I like to listen to the heart because hopefully the baby's still calm, quiet, maybe asleep. Normal heart rate in a newborn is between 140 and 160 beats per minute, and so that's pretty fast. And so trying to listen for extra heart sounds or a murmur can be quite challenging. And so normal heart rate is like dun 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 dun, and with a murmur it's dun 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 dun. And those murmurs can sound different depending on the cause. And some can actually be a normal blood flow through the heart, but some can be a sign that blood is not flowing in the way that it should. The blood flow in a newborn had to make a huge shift during delivery. Before a baby's born, their blood flows out through the umbilical cord and gets oxygenated by mom's lungs, and then will flow back in through the umbilical cord to the baby. Whereas after birth, obviously that's disconnected, and so the blood has to flow through the right side of the heart into the lungs, and then back into the left side of the heart and out to the baby's body. So sometimes certain things show up just as that is happening. So I think this physiology is fascinating, and you can go more in depth on it, but I'm going to leave it there for the moment. So I do remember taking care of one baby boy who had a heart problem that we had no idea was there until after he was born. So I'll tell you his story real quick. He was normal term baby, healthy, and had a couple hours of life. We noticed he wasn't feeding well and that he was breathing kind of fast. And so when babies breathe fast, they almost look like they're panting. And so normal baby's breathing rate can be 40 to 60, and sometimes some of that fast breathing can be normal if it's just temporary and then comes back down, but his was consistently staying at about 80 to 100. So we did what we would normally do for something that's concerning, and you do a full exam and a set of vitals, and he was noted to have a low oxygen level as well, and his heart rate was a little bit up, and on exam he had a murmur. So we ordered a chest x-ray and an echo, which is an ultrasound of his heart, and that showed that he had something called tricuspid atresia. So this is when the tricuspid valve within the heart does not form properly, and not much blood can pass from the right side of the heart into the lungs. So there's a special blood vessel called the ductus arteriosus that is only open before birth and then closes within a few hours to a few days after birth. And that duct allowed blood to bypass the lungs before birth, but as it closed, this little boy could not get blood to his lungs well, so he couldn't oxygenate well. So that was the low oxygen level, and babies will breathe fast to compensate for that, to try to get more oxygen into the lungs, but that still wasn't enough to help him. So he was quickly started on a medicine that can help keep that duct open. He was given some oxygen with a mask or a little nasal cannula, can't remember which, but then he was transferred to a facility that could do the surgery he needed and fix his tricuspid valve. I tell this story just to show how important checking the vitals and doing an exam can be in a newborn. Now to return back to our original baby girl. If she's been wrapped up and I listen to her heart, then I start to unwrap her so I can listen to her lungs and the front and the back and her stomach. And that often encourages some deeper breaths because she's waking up, moving more, maybe opening her mouth, opening her eyes, which allows me to look in those areas. In the mouth, I'm looking for clefts or neonatal teeth. In the eyes, I'm looking for a good reflex, looking for something called the red reflex that can be a sign that there's a brain problem, and also just her pupillary reflex, checking the eyes. Often look up the nose. Don't necessarily check the ears right at birth because there may still be fluid or smegma, which can make it hard to see until after they've had their bath. I press on the belly to see if it's soft or distended, if there's any masses, and then move the legs in a specific maneuver to check the hips called the ortolani and Barlow. And it's basically where you push the long bones of the legs back into the hip sockets to see if the hips are dislocated or not, because that's sometimes a problem that newborn babies have. I also look for certain reflexes by stroking the bottom of the foot or the back, and even turning the head to the side can trigger a certain reflex. There's one that I think is especially important called the Moro reflex, and in this one kind of checks a lot of the nervous system, and you do it by taking the baby's arms and pulling them straight up, and then when you let go, they should have a startle reflex and a little bit of a cry. And those are both part of the reflex. And a Moro can be anywhere from a single to a multiple shaking, and that's still considered a normal Moro as long as it stops within a few seconds. But an abnormal Moro would be if just one arm goes up, or if when you pull the arms up, they just fall and there's no startle response or shaking, or somewhere in between the two. All right, so after that, I often flip the baby over and check the back, looking at the spine from top to bottom, looking for any pits or clefts in the base of the spine, looking for birthmarks that can be found on the back of the neck or back that sometimes can look like bruises. And so we always want to make sure that we document those so that we know they were there and aren't worried that they were caused by something after birth. So this usually completes my exam, and I will wrap her back up or pass her off to the nurse to do his or her assessment. All right, so once the nurse's exam is done, they often move on to the treatments. And these are usually administered by a nurse, but depending on the facility, it could be a tech or a doctor. They're not given in any particular order, but there are typically 3 of them. First one I'm going to discuss is the erythromycin eye ointment, and then the vitamin K shot and the hepatitis B vaccine. So erythromycin is an antibiotic that's applied in a thin strip to each eye of the baby to prevent her from developing an eye infection from chlamydia or gonorrhea. Gonorrhea is considered the more concerning or worse infection than chlamydia, and it's also less common, so that's a good thing. Combined, they used to be the leading cause of blindness in infants before there was any preventative treatment, as often as 3 per 1,000 babies. And starting as early as the 1880s, yes, 1800s, a doctor named Carl Creed started putting silver nitrate in all babies' eyes after birth. He had noticed that this was a common issue and wanted to see if it would help. And surprisingly, the rate of eye infections almost disappeared. So because it was a great success, the practice spread and was continued until antibiotics were developed and available in different formats. And so the erythromycin eye ointment itself was started in the 1960s. Silver nitrate's no longer used because it can cause irritation for some babies, and it is technically possible to have irritation from the erythromycin ointment, but it's less common, and if that does happen, the eye should be gently cleaned and this medication avoided in the future, at least in the eyes. Other ways we can prevent babies from getting gonorrhea or chlamydia in their eyes is by testing and treating moms before delivery. So if we think about this for a minute, if you are trying to avoid getting a certain infection, if the mom doesn't have the infection to begin with, then obviously she can't pass it on to her baby. And so if mom has been tested and treated, and that's done not long before delivery, then we know that there's a very low chance that this infection could be present and spread. Also, if a baby is born by C-section and the mom's water did not break before delivery and mom's not showing signs of infection, then it's very unlikely that that infection has spread up to the baby. Obviously, if a mom has an untreated gonorrhea or chlamydia infection, she's at risk of a lot more issues than just passing it on to her baby. So things that can happen for mom are pain, infertility, pelvic infections, preterm labor, and chorioamnionitis, which is when there's an infection of the amniotic fluid, which is the fluid that's around the baby in the uterus, and that can happen either before or after delivery. So important to watch for. The baby can also have other complications from these infections. So things such as low birth weight, pneumonia is a big one, especially with chlamydia, sepsis, which is an infection in the bloodstream, which is obviously more serious, and then stillbirth is the most extreme when the baby dies before they're born. So obviously there are many reasons to look for and treat this infection before birth, not just to prevent an eye infection. So if for some reason a baby was born and the eye prophylaxis or ointment was not done and the baby starts to develop an eye infection from these bacteria, then treatment can be given, but it needs to be started very quickly within about 24 hours of symptoms so that it doesn't obviously cause any significant eye damage. And sometimes an ointment won't be enough at that point, but we need to treat with oral antibiotics. So as you could probably tell, because this has been such a successful program, overall blindness is much less common from these infections nowadays, and to the point where some countries have stopped recommending prophylaxis for all babies, such as Australia, Great Britain, and Sweden. I think this is a reasonable option if the mom has had good prenatal care, but there are still a lot of areas in the United States where moms do not get good prenatal care. I feel these hospitals need to either continue universal prophylaxis or have a really clear protocol for how to proceed. Many states currently have laws requiring newborn prophylaxis, and only one, New York, does not allow parents to refuse, but most have a policy to allow parents to decline if desired. Usually the ointment is well tolerated with minimal side effects and may even be soothing to the eyes. The ointment rubs in and goes away within a few hours, so there's little effect on vision, and it is a cheap medication, so cost is not usually an issue. But it's obviously important to consider your own risks and benefits and to discuss with your doctor before making a final decision. As you can see, there's a lot to break down here, and that's why there's usually a lot of activity in the delivery room. Our baby girl handled her exams and eye ointment beautifully, and I'm going to stop at this point to take a break before getting into the next two treatments. I hope you enjoyed our discussion, and we'll return for the next part. Thank you, and have a great day. Quick disclaimer. The information contained in this podcast is strictly educational and should not be taken as professional medical advice. Even though I am a doctor, I am not your doctor, and you should always consult with your own healthcare team before making significant changes to your care. Thank you.